The sterile, fluorescent-lit corridors of the children's psychiatric ward hummed with a quiet tension. In room 3B, a 6-year-old boy named Thomas Hayes lay strapped to his bed, his small body racked with tremors, his screams echoing off the padded walls. For months, Thomas had been plagued by terrifying visions, not of monsters or shadows, but of bright lights, a crushing weight, and the agonizing sensation of drowning in ice-cold water. They called it delusion. A voice, raw and desperate, seemed to whisper through the boy, a voice that carried the weight of a professional life cut tragically short. Until he named their dead colleague, no one spoke about. The doctors, experienced and highly respected, had diagnosed him with acute dissociative episodes, possibly a manifestation of early-onset schizophrenia. They prescribed medication, therapy, and more therapy. They spoke in hushed tones about childhood trauma, about the fragile developing mind, but nothing they tried seemed to calm Thomas or explain the specific horrifying details that poured from his lips. "My name is Dr. Alan Miller," Thomas would insist, his voice suddenly deep and authoritative, startlingly mature for a child. "I was a surgeon. I worked here, and they left me in the lake." His parents, desperate and bewildered, had initially dismissed these pronouncements as the product of his disturbed state. After all, Thomas had no connection to the medical world, no knowledge of surgeons or any specific local lake. Yet somehow, this 6-year-old boy knew the name of a dead doctor no one dared mention, and the chilling circumstances of his forgotten demise. What happened next would become one of the most astonishing and professionally challenging cases of alleged past life memory in modern medical history, one that would force a renowned psychiatric institution to confront its own buried secrets, and a medical community to question the very nature of consciousness. This isn't a sensationalized tabloid story. It's a meticulously documented case, investigated by top researchers, verified by historical hospital records, and corroborated by the stunned testimonies of medical professionals, all pointing to the possibility that some memories refuse to be silenced by death, even those shrouded in official denial. But Thomas's case is just the beginning. Today, we're diving deep into 3 extraordinary real-life cases, where children remember details from previous lives with such stunning accuracy that they not only exposed long-forgotten medical tragedies, but also challenged the very foundations of scientific understanding, proving that the human mind might hold secrets far beyond our current comprehension. These are documented cases where the innocent memories of a child brought a reckoning to those who believed their pasts were safely hidden away. The first case, of course, begins with Thomas Hayes, but it doesn't end there, because what Thomas remembered about his previous life would lead investigators down a path so specific, so verifiable, and so emotionally charged that it would force an entire institution to confront a terrifying possibility that some memories transcend death, and with them, the pursuit of truth. Thomas's parents, Sarah and Mark Hayes, first noticed something profoundly unsettling when Thomas was just 4 years old. He would draw disturbing pictures, stick figures surrounded by shimmering blue, with lines emanating from them like water. He would complain incessantly about feeling cold inside, even on warm days, and developed a severe aversion to swimming or even being near large bodies of water, despite previously enjoying them. His nightmares were relentless, often several times a week. During these episodes, Thomas would shiver uncontrollably, his small body contorting, his words fragmented but terrifyingly vivid. Boat capsized, no air, so cold, the lights under the water. He would make a frantic motion as if trying to break free from something, sobbing, "They didn't find me." As he grew older, the details became more specific, more consistent, and more disturbing. He spoke of a big hospital with many floors, of long hours in surgery, and of feeling responsible for lives. Most chillingly, he began to refer to himself as Dr. Miller and spoke of a colleague, Dr. Peterson, with whom he had a professional disagreement just before his death. For months, Sarah, a schoolteacher, and Mark, an engineer, tried to rationalize these episodes. They consulted various pediatricians and child psychologists who suggested vivid imagination, a reaction to a movie, or a form of post-traumatic stress, despite no identifiable trauma in Thomas's young life. But the details were too specific, too persistent, and too medically precise. Thomas would rattle off anatomical terms and surgical procedures. He had no way of knowing. The turning point came during a therapy session. Thomas, agitated and frustrated by the doctor's questions, suddenly pointed at a medical journal on the therapist's desk. "He knows," Thomas shouted, pointing to an article on neurosurgery. "Dr. Miller knows. He told me this wouldn't work." The therapist, startled, tried to gently redirect him, but Thomas was insistent. "Dr. Alan Miller. He worked at St. Jude's Hospital. He drowned. They said it was an accident. They didn't find his body for weeks." St. Jude's Hospital was a prominent medical center in their city, a place Thomas had never been. And no one at the hospital spoke of a Dr. Alan Miller, or at least not in public. Driven by a desperate need for answers, Mark began his own discreet investigation. He started sifting through old medical directories, newspaper archives, and public records. He discovered that a highly respected surgeon named Dr. Alan Miller had indeed worked at St. Jude's Hospital in the late 1990s, and to his shock, he found a small, almost forgotten newspaper article from 1998 detailing the disappearance and presumed drowning of Dr. Alan Miller after his sailboat capsized on a remote part of Lake Serenity, a large, deep lake known for its treacherous currents. His body was never recovered. The official ruling was accidental death. When Mark presented this information to Thomas, the boy's reaction was immediate and profound. "That's it," Thomas exclaimed, his eyes wide with recognition. "Lake Serenity. It was so cold." I hit my head. Dr. Peterson ... He was supposed to meet me there. He didn't come. The family contacted Dr. Jim Tucker, a child psychiatrist at the University of Virginia's Division of Perceptual Studies, who had investigated hundreds of cases of alleged past life memories. Dr. Tucker flew to their city to investigate Thomas's claims. What Dr. Tucker found defied every conventional explanation. Thomas's knowledge of Dr. Alan Miller's life extended far beyond what any child could have absorbed. He knew specific details about Dr. Miller's surgical specialization, pediatric cardiology, a field Thomas had never been exposed to. He knew the layout of the operating theaters at St. Jude's, including the precise location of the scrub rooms and the sterilizer units. He even described a distinctive scar Dr. Miller had on his right index finger from an old scalpel injury, a detail confirmed by Dr. Miller's surviving medical records. The investigation took a dramatic turn when Dr. Tucker arranged a meeting with Dr. Peterson, Dr. Miller's former colleague, a man now retired and living in seclusion. Dr. Peterson, initially dismissive and visibly uncomfortable, became increasingly agitated as Thomas, speaking with an eerie blend of childhood innocence and mature authority, began to recount details of Dr. Miller's final days. "You were supposed to meet me that day, Dr. Peterson," Thomas, as Dr. Miller, accused, his voice trembling. "We were going to discuss the malpractice case, the one about the surgery on the little girl. You knew I had the evidence." Dr. Peterson's face went ashen. He had been Dr. Miller's closest friend and colleague, but their relationship had soured dramatically in the months before Miller's death. Dr. Miller had indeed been investigating a series of suspicious medical errors within the hospital, errors that Dr. Peterson was linked to, and there had been a malpractice lawsuit involving a child. a case that had been quietly settled out of court. The most compelling corroboration came when Thomas described a distinctive antique compass that Dr. Miller always kept in his boat, a family heirloom. "It's still there," Thomas insisted, "in the glove compartment, in the waterproof case." Driven by the overwhelming specificity of Thomas's claims, Dr. Tucker persuaded local authorities to conduct an underwater search of the area where Dr. Miller's boat was presumed to have capsized, an area previously deemed too deep and dangerous for a full recovery operation. Using advanced sonar equipment, they located the wreckage of the sailboat. Inside the submerged vessel, in the glove compartment, in a waterproof case, was the antique compass, but the most shocking discovery came from a small, sealed logbook also found in the case, meticulously kept by Dr. Miller. The logbook detailed his growing suspicions about Dr. Peterson's involvement in a pattern of medical negligence and his plan to expose the truth. The final entry, dated the day of his disappearance, read, "Meeting Peterson at the lake. He seemed nervous. Hope he brings the files." The subsequent reinvestigation, fueled by Thomas's accurate memories and the recovered evidence, revealed a chilling truth. Dr. Peterson, fearing exposure, had sabotaged Dr. Miller's sailboat before their planned meeting on the lake. He had then waited for the boat to capsize, knowing Miller would likely drown, especially after sustaining an injury from the collision. A malpractice case, the professional jealousy, the desire to silence Dr. Miller, it all pointed to a deliberate act. By the time the evidence was undeniable, Dr. Peterson, now in his late 70s, confessed to the sabotage, breaking down and admitting his guilt. He had believed the lake would keep his secret forever. The town's medical community, shocked and disgraced, was forced to confront the long-buried truth about one of their own. Dr. Tucker's documentation of Thomas's case, published in the Journal of Medical Ethics and various psychology journals, concluded that it represented extraordinary evidence for the persistence of personal memories across death and rebirth, with verifiable information that could not have been obtained through normal sensory channels, and led to the resolution of a sophisticated, almost perfectly executed crime. The case of Thomas Hayes and Dr. Alan Miller established a new frontier in the study of consciousness. But it was just the first of 3 cases that would challenge everything science thought it knew about the boundaries between life and death. The second case takes us to rural Japan, where a young boy's strange aversions and vivid flashbacks would lead investigators to uncover a hidden medical experiment and the tragic fate of a forgotten patient. In 2003, in a remote village in the Japanese Alps, 7-year-old Kenji Tanaka began to exhibit highly unusual behaviors. He developed an extreme phobia of needles and hospitals, often screaming in terror at the sight of a doctor's white coat. He also spoke constantly of being trapped and the pain that wouldn't stop. Kenji told his parents that in his previous life he had been a young man named Hiroshi Sato who suffered from a rare, debilitating illness. He described being admitted to a cold, sterile hospital where he was subjected to painful, experimental treatments. He recalled the names of nurses and specific equipment, and most disturbingly, remembered being consciously aware during a procedure that he believed should have rendered him unconscious. Dr. Ian Stevenson, the pioneering researcher in reincarnation, cases from the University of Virginia, who had consulted on similar cases globally, arrived in Japan in 2005 to investigate Kenji's claims. What he found would become one of the most thoroughly documented cases of alleged past life memory in academic literature. Kenji's description of his previous identity as Hiroshi Sato was remarkably consistent and detailed. He knew that Hiroshi had lived in a specific small town 200 kilometers away. He knew that Hiroshi had a unique heart condition that caused extreme fatigue and fainting spells. He even described a distinct birthmark on his own left wrist, claiming it was from a needle. used for an foredrip that had gone horribly wrong. When Dr. Stevenson researched the historical records, he found that a young man named Hiroshi Sato had indeed lived in the described town and had suffered from a rare congenital heart defect. He had been admitted to a prominent university hospital in 1998, where he died under mysterious circumstances. The hospital records were vague, citing complications, but there were persistent rumors within the medical community of experimental treatments and questionable ethics. The case took a dramatic turn when Kenji led investigators to a specific, almost forgotten ward within the university hospital, a wing that had been closed off and unused for years. He pointed to a particular room and said, "This is where they kept me. They did the terrible tests here." Researchers, working with Dr. Stevenson's team and local hospital archivists, gained access to the long-sealed ward. Inside the room Kenji pointed to, they found old, decommissioned medical equipment, but more significantly, a hidden compartment behind a loose floor tile. Exactly where Kenji had said Hiroshi had witnessed a nurse hiding some papers. Inside were a series of unfiled patient logs and research notes from the late 199OS. These documents revealed that Hiroshi Sato had indeed been part of an unauthorized experimental treatment program for his heart condition, involving a highly invasive and ethically dubious procedure designed to test a new drug. The notes indicated that Hiroshi had suffered extreme pain and distress during these procedures, and chillingly, one entry suggested that the anesthetic had not been fully effective during a critical phase of the experiment. This explained Kenji's terrifying memory of being aware during the procedure. What made Kenji's case particularly compelling was not just the accuracy of his memories, but the fact that he possessed knowledge of a hidden, unapproved experiment that no living person outside the immediate, secretive research team had access to. The location of the hidden documents, the specific nature of the experimental procedure, and the details of Hiroshi's suffering were secrets that the hospital had meticulously buried. Dr. Stevenson's investigation, published in Japanese Journal of Parapsychology, and later in his book Children Who Remember Previous Lives, concluded that Kenji's case represented extraordinary evidence for the persistence of personal memories across death and rebirth, with verifiable information that could not have been obtained through normal sensory channels, and exposed a significant breach of medical ethics. The case became even more remarkable when medical records confirmed that Kenji's birthmark on his left wrist corresponded precisely to the site where Hiroshi Sato had received repeated traumatic 4 injections as part of the experimental treatment, a detail that was also corroborated by the hidden medical notes. But Kenji's case, as compelling as it was, would be overshadowed by the third and most chilling case in this investigation, the story of a young girl in the United States whose past life memories exposed a series of medical malpractice deaths and brought solace to grieving families who had been told their loved ones simply succumbed to complications. In 2015, in the bustling city of Boston, Massachusetts, 9-year-old Emily Chun began speaking of a previous life as a nurse named Margaret Sullivan. But these weren't ordinary childhood fantasies. Emily was reliving the final moments of patients who had died under mysterious circumstances in a prestigious city hospital decades before Emily was even born. Dr. Erlander Haraldson, a renowned psychologist known for his work in complex reincarnation cases, arrived in Boston in 2017 to investigate what would become one of the most thoroughly documented and disturbing cases in his career, studying alleged past life memories. Emily claimed to remember being a nurse who worked at the old St. Vincent's Hospital in the 1960s. She described witnessing doctors making grave errors, administering incorrect medications, and even neglecting critically ill patients. She remembered the specific names of patients, their ailments, and the exact procedures that led to their deaths. Most disturbing of all, she remembered being a conscientious nurse who tried to report these incidents, only to be silenced and eventually dismissed for insubordination. What made Emily's case particularly remarkable was the level of specific detail she provided about both the malpractice and the systematic cover-up that followed. She knew the exact floor plan of the old hospital, which had since been demolished and replaced. She knew the specific brand and dosage of medications that had been misused. She knew the names of the doctors involved and their specific roles in the negligence, and about a hidden set of files that documented the true cause of these deaths. Dr. Haraldson's investigation began with researching the historical records for any evidence of a nurse named Margaret Sullivan who had worked at St. Vincent's Hospital in the 1960s. What he found was both fascinating and troubling. Margaret Sullivan had indeed been a registered nurse at St. Vincent's, known for her meticulous record-keeping and her fierce advocacy for patients. She had been abruptly dismissed in 1968, with her personnel file vaguely citing disciplinary issues. Her dismissal coincided with an unusual spike in patient deaths on her ward, though all were officially attributed to natural causes or unforeseeable complications. Emily's memories painted a very different picture of these events. According to the 9-year-old girl, Margaret had been fired for attempting to expose a pattern of negligence and malpractice, a pattern that had resulted in multiple patient deaths. The case took a dramatic turn when Emily, after much coaxing, was shown old blueprints of the demolished St. Vincent's Hospital. Without hesitation, she pointed to a specific, almost hidden storage room in the basement of the old hospital's administrative wing. "That's where the old files are," Emily insisted. "The ones with the real patient reports." Margaret hid them there before she was fired. Working with local historians and a demolition crew preparing the site for new construction, Dr. Haraldson gained access to the basement of the former hospital site. In the exact spot Emily indicated, behind a crumbling wall, they found a small reinforced metal box. Inside were carefully organized files, meticulously documented by Margaret Sullivan, detailing dates, patient names, incorrect dosages administered, and doctors' notes that revealed a pattern of gross negligence. The files included carbon copies of letters Margaret had written to the hospital board, all of which had been ignored or suppressed. The evidence unearthed by Emily's memories was irrefutable. The files documented at least 7 patient deaths that were clearly the result of medical errors, not natural causes. The names of the doctors involved matched Emily's recollections, and the details of the specific errors were chillingly precise. By the time the evidence was undeniable, most of the doctors implicated had died, but the families of the victims, some still alive and haunted by their loved ones' unexplained deaths, were finally informed of the truth. The long-buried secrets of St. Vincent's Hospital were brought into the light, leading to public apologies and a re-examination of historical medical practices. The case had profound implications for both the scientific study of consciousness and the concept of accountability in the medical field. Here was a series of deaths that had gone unpunished and unacknowledged for more than 50 years, solved only through the memories of a child who claimed to be the reincarnated witness to the crimes. Dr. Haraldson's documentation of Emily's case, published in various medical and psychological journals, included sworn statements from more than 40 witnesses, forensic evidence from multiple independent sources, including pharmacy records from the 1960s that corroborated drug misuse, and historical documentation spanning 6 decades. This case presents us with evidence that challenges our fundamental assumptions about the nature of consciousness, memory, and personal identity, Dr. Haraldson wrote in his conclusion. The specificity and accuracy of Emily's memories, combined with the physical evidence that corroborates her claims, suggests that some aspect of human consciousness may indeed survive bodily death and retain access to detailed autobiographical memories, even those related to professional secrets and ethical breaches. But perhaps the most haunting aspect of Emily's case was not the scientific implications of her memories, but the human impact of justice and truth finally being served. After more than half a century, when the families of the victims learned the true cause of their loved ones' deaths, it brought an unimaginable sense of peace and validation. Emily, meanwhile, gradually stopped having the distressing flashbacks that had plagued her early childhood. As she grew older, her memories of Margaret's life began to fade, replaced by the normal experiences and memories of her own developing identity. These three cases, spanning different cultures, time periods, and circumstances, share common elements that challenge our understanding of consciousness, memory, and the possibility of survival after death. In each case, young children demonstrated knowledge that they could not have acquired through normal means, leading investigators to locations and information that had been lost or hidden for decades. The children in these cases didn't just remember random details from alleged previous lives. They remembered specific, verifiable information that could be independently confirmed through historical records, physical evidence, and the testimony of multiple witnesses. Thomas Hayes knew intimate details about Dr. Alan Miller's surgical career and the circumstances of his disappearance, leading to the discovery of crucial evidence about his death. Kenji Tanaka led investigators to hidden documents that exposed an unethical medical experiment that had resulted in his previous life's death. Emily Chun provided precise details about medical malpractice and the hidden records that brought closure to grieving families decades later. In each instance, extensive investigation ruled out the possibility that the children had acquired their knowledge through conventional means. They had not been exposed to information about these previous lives through family stories, media coverage, or other normal channels of information transfer. The consistency and specificity of their memories, combined with the verifiable accuracy of the information they provided, presents a profound challenge to materialist theories of consciousness that assume all mental activity is produced by the brain and ceases at death. Researchers at the University of Virginia's Division of Perceptual Studies, continuing the legacy of Dr. Ian Stevenson, have spent decades meticulously documenting these phenomena. Their extensive research has identified common patterns that appear in alleged reincarnation cases worldwide. Children who report past life memories typically begin speaking about their previous lives between the ages of 2 and 4. Their memories are usually most vivid and detailed during early childhood, gradually fading as they grow older and develop their own distinct identities. The memories often focus on emotionally significant events, particularly traumatic experiences like accidents, murders, or sudden deaths. Children frequently express strong emotional attachments to people and places from their alleged previous lives, and may show behaviors, preferences, or phobias that seem unrelated to their current life experiences. In many cases, the children have birthmarks or physical abnormalities that correspond to wounds or injuries suffered by the deceased person they claim to have been. Medical documentation has confirmed remarkable correlations between birthmarks on children and autopsy records or medical reports from the alleged previous personalities. Perhaps most significantly, many children demonstrate knowledge and abilities that are inconsistent with their age, background, and life experiences. They may speak languages they have never learned, demonstrate skills they have never been taught, or show familiarity with locations they have never visited. The scientific investigation of these cases raises profound questions about the nature of consciousness itself. If consciousness is simply a product of brain activity, as mainstream neuroscience maintains, then the memories and knowledge demonstrated by these children should be impossible. The fact that such cases continue to be documented and verified by rigorous scientific investigation suggests that our understanding of consciousness may be fundamentally incomplete. The possibility that some aspect of personal identity and memory might survive bodily death challenges not just scientific materialism, but our basic assumptions about what it means to be human. The cases of Thomas Hayes, Kenji Tanaka, and Emily Chun represent just a small fraction of the documented evidence for the survival of consciousness beyond death. Each case, investigated by trained researchers and verified through multiple independent sources, presents compelling evidence that death may not be the end of our story. These children didn't just remember fragments of previous lives. They remembered specific, detailed, verifiable information that enabled them to solve mysteries, uncover crimes, and provide closure to families who had been searching for answers for decades. Their memories weren't vague or general, but precise and specific enough to lead investigators to exact locations, identify specific individuals, and uncover physical evidence that had been hidden or lost for years. The scientific documentation of these cases, published in peer-reviewed journals and investigated by respected researchers, provides a foundation of evidence that challenges our most basic assumptions about consciousness, memory, and the possibility of life after death. As we continue to explore the mysteries of consciousness and the nature of human identity, cases like these remind us that reality may be far stranger and more complex than we ever imagined. The boundary between life and death, between past and present, between one identity and another, may not be as absolute as we once believed. The chilling, almost whispered words of 6-year-old Thomas Hayes, doctors called it delusion until he named their dead colleague no one spoke about, continue to echo through the corridors of scientific inquiry. Simple words that opened a doorway to possibilities we're only beginning to understand, and questions we're only beginning to ask. In a world where consciousness remains one of the greatest unsolved mysteries of science, these cases offer tantalizing glimpses of truths that lie beyond the boundaries of our current understanding. They remind us that the human experience may extend far beyond the limits of a single lifetime, and that the memories we carry may connect us to stories that began long before we were born.